Can strengthening the core muscles of the foot help prevent running-related injuries? Welcome to Research Thursdays. I'm Dr. Matt Meiderd, physical therapist, passionate about helping you run smarter, safer, and faster. This week we're looking at a study from 2020 that asked this very same question. They took 118 people, they split them into a control group that didn't do any specific interventions for the foot, and they split it into a training group. So they wanted to see, with this protocol of 14 exercises that have to do with muscles that strengthen what's called intrinsic, muscles that originate and insert within the foot. This is what's considered to be the core muscles. And strengthening some of the extrinsic muscles, muscles that originate outside the foot ankle, but then they do insert within the foot and ankle. And at the end of this post, I'll go over these individually in a little bit more detail. And so what did they find? They found over 12 weeks, compared to the control group that didn't do these exercises, the control group had a 2.5 times increased risk of getting a running-related injury. What does this suggest? This suggests that strengthening the muscles within the foot can have a shielding or protective mechanism against running-related injuries. But what they found was it wasn't until 4 to 8 months of doing these exercises 3 times a week did it start having that protective mechanism. So I think things that we have to ask ourselves is, one, are we willing to invest this much time of doing 3 to 4 times a week? For the first 2 months, they did an extra session within the physical therapy office with a physical therapist to ensure they were doing them correctly. But 3 times a week, around 30 minutes a session for an entire year, can we be consistent enough and make it to that 4 to 8 month time frame where we start to see that protective mechanism and those protective effects? I think the questions we have to ask ourselves is, which of these exercises in particular are the most beneficial? Can we lean this out, have it be less exercises? What's the least amount that we can do throughout the week to still have the maximum benefit? So those are questions that we want to ask ourselves for future research. What the results do tell us is there appears to be a benefit, a protective shield, if you will, of strengthening the foot with preventing running-related injuries. Therefore, the foot muscles need to be strong and durable. There's a big kind of argument out there, the research split of, is it a top-down or a bottom-up control? Meaning, is it the foot ankle or is it the hip that's responsible for most of running and running-related injuries? This research article is suggesting more of a bottom-up approach. So the action: incorporate some foot strengthening muscles. If you're in a shoe all day and you come home, you either put slippers on or you keep your foot in a shoe, it is true, if you don't use it, you lose it. Part of what makes up our arch of our foot is muscles, and another part is ligaments. The muscles, where if we don't adequately challenge them, they adapt to their demands. If they're not demanding a whole lot, they do get weaker. And if we transition from that to running thousands of steps, being on one foot, where we need some of the muscles of the arch to come to play, that's where we can start getting into a little bit more trouble. So let's go over these exercises individually and see if maybe you can start incorporating some of these into your routine, or maybe you're already doing some of these to give you some validation. So the first one, feet tapping, 30 reps. What they were doing in sitting, keeping the heels down, is just quickly tapping the balls of the feet. The progression for this one is doing more repetitions with time. Heel raises, working on raising the body up and lowering the body down using the calf muscles. 30 reps for this one. Next, this is a little coordination. Opposite foot is doing the opposite action. While one foot is inverting, the other foot is everting. Inversion is where the arch is coming up. Eversion is where the arch is coming down. So we're doing this opposite side to side for 30 reps, 1 second hold at each position. Forefoot abduction. This is with the resistance band. The band goes near the forefoot. Band resistance is coming from inside towards the out. Keeping the heel down, we're abducting. Abduct means away. keeping the heel down. Try and have as minimal help or assistance from the knee and hip as possible, making sure it's purely coming from the foot ankle. Massage, using your thumbs to try to knead, kind of like dough, and try to break up and massage the bottom of the foot. 20 seconds for this one on each side. Toe twist. You're grabbing each toe and you're turning and you're twisting around its vertical axis. You're doing this for 10 reps on each toe on both feet. The rubber ball slide. So this is going forward and back, having a rubber ball or some firm ball where you're going parallel with your arch, in line with your arch, trying to loosen up the bottom of your foot. Next is 10 reps of toe and ankle flexion. Bands around the top of the foot, of the big toe and the fingers, or the toes they call them, and you're trying to resisted pull up and down against resistance. The next one was the grab and hold squeeze. To try to grab and hold, and you'll feel the muscles of your arch burn, hold for 5 seconds, and release. And you do that 5 times on each foot. I didn't have a toe separator, so I made do. You could take a paper towel, something to go between the toes, and you're trying to squish or adduct the toe separators, strengthen the muscles within the foot. Next is squeezing a ball or a cloth with primarily just the little toes, excluding the big toe. Squeeze, hold for 5 seconds, 5 reps, release both sides. And then just working on isolating the toes, and I have a hard time with this, going out, abducting, and in, adducting, separating out and approximating the toes. So in the foot, there's different arches. In this first one, this short foot exercise, we're trying to lift just the inside part of the foot from the big toe all the way to the heel, trying to raise that part of the arch up. 10 reps, 5-second hold. Versus the plantar arch raise is we're trying to get the entire arch from the entire ball of the foot to the heel to lift up without lifting the toes or without lifting the heels. As you can see, I have pancake flat feet. This is challenging for me. This is a good exercise that I could incorporate to try to build up the core or the foundation of the feet. So I hope that was helpful for you to get an idea of, if you hear core muscles of the foot, what does that even mean? What are some examples, some exercises you could do or incorporate within your routine to make sure you are strengthening the muscles of your foot and seeing, can there optimally be a protective mechanism or reducing the risk of running related injuries from doing these exercises? Questions, comments, concerns, let me know down below. If not, I'll see you next time.